When you first see your doctor about diabetes, I'm sure you'll have a lot of questions. They're going to ask you a lot of questions too. I'm Dr. Melissa Young, and I'm an endocrinologist. So what are some things that you need to know about your first visit after you've been diagnosed with diabetes? The first time you see your doctor about your diabetes, they're going to do a physical exam, and that's going to include your height and weight. Although weight is just one way that we measure health, it is important when we're tracking diabetes progress. Very often, they will examine your feet to check for any wounds or any signs that you're at risk of developing any wounds on your feet. They're going to want to know about what other medications you're taking, what other medical conditions you have. They're going to ask about your family history. They'll also ask you whether or not you smoke and how much alcohol you drink. They'll talk to you about lifestyle modification, diet, exercise. They will probably prescribe some medication, and they will talk to you about tests that need to be done. The frequency at which you have to check your blood sugar will depend on whether or not you have type 1 or type 2 diabetes and what medications you're on. So you'll have to have a discussion with your doctor about what the most appropriate frequency is for you. I'm sure you'll have a lot of questions when you first go to your doctor about your diabetes. Some of the things you can ask are what to expect, what things that you'll need to do to keep yourself healthier, whether or not you'll need to take medications. You should also ask if you are prescribed any medications about what side effects to expect. Let's face it, all medications have the potential to cause some side effects. Most of them are mild and tolerable, and I think it's easier when you know what to expect so that you're not caught off guard. You should also ask about what complications may develop and how you can prevent them, and what other healthcare professionals you should see in order to prevent those complications. You may be referred to other healthcare professionals, such as an eye doctor. Most patients with type 2 diabetes can be managed by their primary care doctor, especially in the early stages. If, however, the diabetes is difficult to manage, or if there are the beginnings of complications, then it may be worthwhile seeing an endocrinologist. Not everyone with type 2 diabetes needs an endocrinologist, and quite frankly, there's not enough of us around to see everyone. But certainly if people are on 2 or more medications and are still struggling, or if they are on insulin and are having difficulty managing their blood sugars, then seeing an endocrinologist is worth it. Your primary care physician may be able to refer you. If not, you can find them either on the Endocrine Society website or on the ACE website. ACE is the American Association of Clinical Endocrinology. Ask your doctor about being referred to a nutritionist or diabetes educator. I think that diabetes education is a woefully underutilized part of diabetes management. I met patients who've had diabetes for 10 years who not once have spoken to anybody about diet. Although your doctor may give you some tips and some ideas, they really don't have the time to spend half an hour with you just talking about what you eat and what you should be eating. I'm going to be honest with you. Not all doctors know how many carbohydrates somebody should have. So I think a referral to a nutritionist is important. If you aren't referred to a specific diabetes educator, you can find them on the ADA website, the American Diabetes Association, and you can look for specialists in diabetes education. You can also find other healthcare professionals that manage diabetes. I know there was a lot of information, and if you have additional questions, please speak to your doctor. If you've recently been diagnosed with diabetes, visit Healthline.com. There are hundreds of articles on diabetes.